Hi, I'm Jim Bergman. I work as a pediatric dermatologist and pediatric allergist in Vancouver. Impetigo is one of the most common pediatric infectious disorders. It does affect the elderly as well and adults, but it's more common in young kids. In fact, it's estimated that at any one time in the world, there's approximately 164 million kids infected with it. It's due to Staph aureus and Strep pyogenes. You can get two different clinical presentations. The more common is the yellow crusting that occurs around the nose and mouth. However, there's a bullous form that can more frequently occur in the folds. Impetigo, it's really infectious, so you want to avoid, when you're infectious, you want to avoid direct contact with the secretions. But when you actually get it, it's often self-limited, but we usually treat it. The treatment is usually topical when you have more localized disease, but when you get an extensive infection, or if there's other issues such as immunocompromise or other concomitant illnesses, then you'll treat orally. But the usual treatment when it's more localized disease is a topical antibiotic. There are a number of therapies that have been around for decades. The classic one that all pediatricians, family doctors, dermatologists are very comfortable with is fetacidic acid and mupirocin, which are fusidin and Bacterban. And what we often do with those is treat 2 or 3 times per day for up to 2 weeks to clear the disorder. And we all feel comfortable with the efficacy and safety of those products. However, now, as of this coming year, there's a new product that's going to be entering in the market. The new product is called Ozanex or Ozanex. It's a new category of topical antibiotic. It's a non-fluoridated quinolone. The potential advantages it has a shorter duration of activity. So instead of having to treat for a week or 2, it's 5 days of treatment. Instead of having to do 2 or 3 times a day treatment, it's twice a day treatment. It's bactericidal instead of bacteriostatic, so it kills the bacteria instead of inhibiting and killing. And also, it has 2 mechanisms of actions that impair DNA, which may increase the potential or decrease the potential for resistance. There are a small number of patients within the studies that they've done with this new product where they actually looked at its activity against a resistant strain of bacteria called MRSA, which a lot of people are aware of and worry about. And it appears to be, at least in a small population, which is about 10 patients, it appears to be 100% active against that. So that's an important factor. Now, we don't know whether resistance will be induced with the prolonged use, but at this point, it's useful against MRSA. Ozanex is, again, we don't know the exact price right now. However, it appears that it's going to be very comparable in pricing for a treatment course as the other products available. It's going to be available by prescription. So if someone has extended health, they should get coverage. It's a twice daily application and also only 5 days, which is always a problem. Anyone who's taken antibiotics themselves will know that they did not take the entire course. It's very rare for a patient to actually to follow the whole course and do the whole number of treatments. So the faster you can do something, the less number of treatments is always better as far as encouraging adherence. With the products we already have, fusidin and Bacterban, we feel comfortable with the safety and we have years of experience. Whenever a new drug comes out, there's always concern, especially when you're dealing with kids. You get more worried about, the hurdle to jump over is much greater, especially in a parent's mind, about risks. It's a new drug. However, there's been the clinical studies done on the pediatric population have shown no significant side effects. It's basically the same as placebo. And they've done systemic studies where they've actually, in animals, given it high dose and have not had problems. So when it's used according to the monograph, which is twice daily, up to 10 square centimeter application. There's no systemic absorption, and there's a 0.3% risk of side effects, which is usually just local irritation. If a child is impetigo, you should get treatment, because you'll be the least favorite parent in the classroom if you send them to school and they have impetigo and little Johnny, the child sitting next to them, gets impetigo. So until they've started treatment, they should keep them away from school. And then just see their family physician at their clinic and get treatment, whether it's any one of the 3 topical therapies, if it's a localized disease, or oral therapy, oral antibiotics that can kill staph and strep if it's more generalized.